Hello! In this video, we will teach you the basics of simple interrupted sutures. We will identify the parts of the laceration repair kit, properly set up the procedure and patient, and demonstrate proper technique. The purpose of this video is purely educational. Let's go over your needed supplies: laceration repair kit, appropriate suture type and amount, gloves, sterile if necessary, let gel, and Tegaderm. Before performing the laceration repair, briefly clean the wound and any foreign bodies or dirt. It may be necessary to obtain an X-ray. Insert a let-soak gauze or cotton ball directly into the laceration. Secure it in place with a Tegaderm. Let stands for lidocaine, epinephrine, and tetracaine. It will take approximately 20 minutes for effective numbing. While waiting for the let to take effect, order all necessary supplies including irrigation, towels, extra gauze, basin, steri strips, absorbent chucks, and a Mayo stand. Have the patient be put into a gown and request for any holders if necessary. This would also be a good time to order any patient analgesics that require oral or intranasal route. Don't forget to utilize Child Life. At this point in the video, we will discuss the contents of the laceration repair kit. When opening the laceration kit, there are two sterile wrappers. The outer wrapper can be opened from the designated corner and pulled back. You will then find a kit encased in a white dressing. You can touch this with non-sterile gloved hands. When removing the white dressing, place the laceration kit on top of the Mayo stand with the opening facing up. The Mayo stand should be on the same side as your dominant hand. Exercise standard precaution when pulling back the white dressing. Inside the kit, you will find non-sterile gauze, a large gauge needle, small gauge needle, 5 ml Luralox syringe, a small plastic cup, needle holders, tooth forceps, and scissors. Needle holders should be held with your dominant hand. They are also sometimes referred to as drivers. Put your thumb through one handle and place your middle or ring finger through the other handle. The tooth forceps are often referred to as pickups. Hold the forceps with your non-dominant hand in the same way you would hold a pen. Be gentle when using tooth forceps to manipulate the skin. Do not grip it too tightly or you may damage the wound's edge. Scissors are used for cutting sutures. Position your index finger at the base of the blade to make your movements more precise. Rest the blade on your index finger of your non-dominant hand to increase accuracy when cutting. Basics for wound management. All wounds should have local anesthetic infiltration before the intervention. Take care in cosmetically sensitive areas such as the lip, as this may distort your normal anatomy. Following this, the wound should be thoroughly washed and be examined for internal damage. Patients should be up to date with their tetanus immunization. Wound edges should be debrided if the wound is contaminated. If there is no damage deep to the skin, then primary closure can be performed. Setup for simple interrupted sutures. Wash the wound and debride the skin edges if ragged or dirty. If you are certain that there is no deep tissue damage, you may proceed to close the skin. Load your needle holder by placing the suture in the tip of the holder, 2/3 of the distance from the tip of the needle. Plan the entry and exit of your suture on either side of the wound. The suture should lie perpendicularly across the wound with equal depth and distance from the wound edge. On a cross-sectional view, the final suture, once tied, should appear square. Performing a simple interrupted suture. Out to in. Gently lift the skin with the forceps and pierce the skin surface with the needle perpendicular to the skin at approximately 4 mm from the wound's edge. Supinate your wrist so that the needle passes through the dermis and rises out of the middle of the wound. Use your forceps to hold the needle while you release your needle holder. Be sure not to grab the needle by the tip. The needle will dull. Re-grasp the needle in the same place with your needle holder. In to out. Lift the opposing skin edge gently with your forceps. This time, the needle must travel perpendicularly through the dermis from the inside to the outside. Use the curvature of the needle and supinate your wrist to move the needle through the skin. Equal needle bites of depth and distance from the wound should be taken to allow the wound's edge to oppose equally and neatly. Again, use your forceps to grasp the needle and pull it through the skin. You should continue to follow the curvature of the needle as it travels through the skin, pulling the suture through as you go. You should now have a suture crossing perpendicularly to the wound, approximately 4 mm from the wound's edge. Tie the knot. Put down the forceps. Pull the suture through so there is approximately 3 cm of length on the opposing side. Hold the suture in your non-dominant hand and the needle holder in your dominant hand. Loop the suture away from you around the needle holder twice. Then grasp the tip of the suture end with your needle holder. Pull the needle holder towards you and push your non-dominant hand away to lay the first knot. Let go of the suture with your needle holder, but keep hold of it in your non-dominant hand. Now loop the suture back towards you around the needle holder once and grasp the tip of the suture end with your needle holder. Push the needle holder away from you and bring your non-dominant hand towards you to lay the second knot. Finally, loop the suture away from you around the needle holder once, then grasp the tip of the suture end with your needle holder. Pull the needle holder towards you and push your non-dominant hand away to lay the final knot. Once the knot is tied, use the needle holder to pull the knot to one side so it is not overlying the wound. This will allow for better healing. Now cut the suture between 5 to 6 millimeters in length. If it is too short, the knot will come undone. If it is too long, the suture material will become trapped within other knots and they will come undone. Continue the above process until the entire laceration has been repaired. Once you have completed suturing, make sure that all sharps are accounted for and properly disposed in the sharps bin. You have now completed this video and should feel confident in performing simple interrupted sutures.